The practice of home health physical therapy during the COVID-19 pandemic changes a lot. The infection control is given 100% or more emphasis for protection of both the healthcare workers and the clients from all the infection spread and control. Personal protective equipment during this time of COVID-19 pandemic is a must. It became not just popular but a mandatory thing for all healthcare workers to use to minimize exposure to infectious microorganisms or any hazardous materials in the clinical environment. Seeing clients in their homes entails a step-by-step procedure for infection control to avoid spreading of the COVID-19 virus. Just like any other standard or universal precaution, the COVID-19 infection control precautions is like a steroid. It's like an standard precaution control on steroids. So meaning you really have to do it not just 100% correct, but 100 times 100% correct. Okay, so once you get to the patient's house and you park on the parking area, in your car, you want to make sure you do all this 1, 2, 3, 4, 5 to 6 steps. So step number 1, you wear your gloves before you hand sanitize, and then you wear your mask in between. Use a face shield, then the face shield or eye shield. Then you can wear your clean gown, wear a hair covering and a shoe covering. And you want to make sure that the home care bag that you're bringing inside the patient's house, you will be doing a proper bag technique. And this is another topic that most home care clinicians are aware of. And then step number 6, you're already inside the house of the client. You, as I've said in step number 4, you want to make sure that your home care bag technique, you will have an extra bag layering on tables or chairs wherever you put your bag. And then, of course, number 7, you treat your patient and have fun while you're wearing your full PPE and making sure you're doing proper infection control at all times during the treatment. Now you finish your treatment, you have to have your patient sign either on paper or on your tablets. This is not table, it's tablets. And before I have to have them use a pen, but during the pandemic, right now, I'm gonna have them use their finger to sign. And you also want to make sure that number 8, so everything you already finished and you said bye to the client, you go out of the house. And in the before you go to your car, you want to make sure you take off the gowns, your hair and foot covering, and your gloves and your mask. You put it inside a garbage bag, and then you throw it away in the client's garbage if they have it, if possible. If they have it outside, if there is no garbage outside, you ask the client that you are going to put those plastic bag outside the client's house, and they will be the one to put it in their garbage. Anyhow, this depends on every home care. So it is PP is before COVID-19. So just like what we've been doing during the pandemic, we still have all those steps that we follow from 1 to 9. And so, however, in the case of prior to COVID-19, we don't do the PPEs on steroids. We do the regular standard precautions depending on the problem of the patient. If the patient has a respiratory issues, so and then there is any contagion or contagious disease that the patient is carrying, so we do the droplet precautions, which includes wearing a mask, a face shield, and a gown, and of course gloves. And then we discard all these materials or all these PPEs before we go out of the patient's house. And we also put these PPEs either before we get into the patient's house or inside the patient's house. And then if the patient has a MRSA, so it's more on the contact precautions. So most of the time we wear gloves, we wash our hands, we use the hand sanitizers. We don't need to wear mask if it's a contact precaution. And if the patient has C. diff, then it's another contact precautions. So anything that has to do with contact precautions, we wear gloves and we sanitize our hands, we wash our hands. We don't need to wear gloves, and then we discard all the PPEs, put it in a plastic bag, and then throw it away in the garbage in the patient's house. And with the bag technique, it's always any kind of patient, we use it in a proper way for infection control. And sometimes we use two, or I do personally use two bags so that I can exchange depending on what type of patients that I have. So those are the infection control prior to the COVID-19 pandemic. We still follow the precautions. We still do all the infection control, the universal precautions, the standard precautions depending on the disease that the patient has. And also every year it is a must that we in the home healthcare, as home healthcare clinicians, we have to do a continuing education for infection control. This is done both during the COVID and non-COVID pandemic in a home healthcare setting. Thank you all for listening, and I hope you're getting something from this.